Well, for me, emergency medicine was a rotation that I really enjoyed as a medical student, and I really think that that is the primary thing that you should consider when you're considering choosing a specialty that you enjoy working at, and you can make everything else work if you enjoy it. For me, I liked the pace of emergency medicine. I loved the variety. I loved moving from one case to another, where you might see a pediatric case, an OB case, a trauma, a chest pain, a stroke, all in rapid succession. I loved the variety. Emergency medicine is one of the specialties where we go home at the end of the shift and you can have a tangible benefit to your work. You have patients that you know they walked out the door feeling better than when they walked in. We're able to fix traumatic situations such as lacerations, fractures. We're able to correct those in short order. We're able to save people's lives who are in cardiac arrest. We're able to get people rapid treatment for strokes. So it's a very tangible reward to your work that at the end of the day you can look back and say, I helped all these people today. It's very rewarding. For anyone who's considering a career in emergency medicine, I recommend that they think, first of all, is this the right specialty for me? An emergency physician is someone who is very bright, motivated, energetic, enthusiastic, and able to multitask and switch tasks very rapidly. An emergency physician has to be someone who is able to switch from dealing with a traumatic cardiac arrest and notifying the family of that, and then rapidly put on a happy face and deal with the mother of a young child who is doing fine. So you have to be able to switch rapidly from one clinical scenario to another. You have to be able to rapidly adapt to changing circumstances and varying needs. You should be the kind of person who is not easily flustered, someone who's calm and even-keeled, someone who is able to take charge of the situation and resume a leadership role in the emergency department. All those are important characteristics. And that being said, as a program director, the things we look for in residents, we're looking for people who have all those personality traits, and we're looking for someone who's very enthusiastic, motivated, enjoys their work, and shares that vision with the staff and colleagues around them. Well, emergency medicine has a lot of flexibility in scheduling. So there are many emergency physicians who might work part-time for whom family or other priorities are important to them in their lives, and they may choose to work part-time. A full-time emergency physician could be anywhere from 32 to 50 hours a week, depending on the local practice. So most emergency physicians do have a fair amount of time, free time, for whatever they choose. Some people use that for their careers, for doing research, administrative work. Some people have hobbies and sports that they enjoy. Some people use that time for family time. So it's a great specialty in that regard, that we have all the flexibility to do whatever we want. In my case, for example, I have 4 children, and when I was raising the children, I always worked part-time, so my family was a priority to me. And so that emergency medicine was a great specialty that made that a reality to me, to spend time with them as they were growing up. And then now that they're grown, I can work full-time and do whatever I want. So it's a great specialty for flexibility. I think we face a lot of challenges that other specialties share. We face challenges in the financial arena in remuneration from patients and from insurance companies. That's always a challenge for us. We have a lot of challenges in access to care. Emergency medicine is often the safety net for patients who don't have access to care. So if patients don't have a primary care provider, they'll come to the emergency department. So we see a lot of non-urgent care as well for patients who just lack access to care. So I think other challenges that we face in emergency medicine, hospital crowding is a big issue that affects us. And in many institutions, if the hospital is full, the emergency department becomes the overflow area. And so the emergency department, many emergency departments are filled and overfilled with patients who are boarding in the emergency department waiting for hospital admission. So many departments have hallways blocked with patients. So crowding is a big issue affecting us. I think that those are the biggest things facing emergency medicine right now. I think the most important thing is to try it out and see if it's a specialty for you. There are many people who I've seen go both ways. They thought they were going to love emergency medicine. When they actually did it, it wasn't for them. And the opposite can also be true. You may not think of emergency medicine as a specialty for you, but if you try it out, you may actually enjoy it. So it's not for everyone, but if you enjoy a fast-paced environment with lots of variety, lots of hands-on, lots of procedures, it's the specialty for you.